Cannabis is increasingly used by individuals with mental health conditions, with many turning to it in hopes of managing symptoms like anxiety, depression, or stress. But what does the science actually say about its effectiveness and safety? In this video, we'll explore the current evidence, highlight key risks, and discuss what clinicians and patients need to know. Let's begin by understanding why cannabis has become such a popular option for those seeking relief from mental health challenges. Many people with mental health conditions report using cannabis to help manage their symptoms. This includes those struggling with anxiety, depression, post-traumatic stress disorder, and attention deficit hyperactivity disorder. The perception that cannabis is a natural remedy or safer alternative to pharmaceuticals has contributed to its widespread use. However, it's important to examine whether these beliefs are supported by scientific evidence and what potential risks may be involved. Despite its popularity, the potential benefits of cannabis for mental health conditions remain poorly studied. Most available research is limited in scope and quality, making it difficult to draw firm conclusions. While some users report symptom relief, the scientific community emphasizes the need for more rigorous studies to truly understand cannabis's effects on mental health. This uncertainty makes it crucial for both patients and clinicians to approach cannabis use with caution. One area that has received some attention is the use of THC-predominant cannabis for post-traumatic stress disorder or PTSD. However, the evidence so far is of low certainty and suggests that THC may not significantly improve PTSD symptoms. This means that while some individuals might feel temporary relief, the overall impact on PTSD is unclear, and the risks may outweigh the benefits. When it comes to long-term use of THC-predominant cannabis, the evidence is even more limited. There is insufficient data to clearly characterize the effects on conditions like anxiety, depression, and ADHD. This lack of information means that patients and clinicians are often making decisions without a solid scientific foundation, increasing the potential for unexpected negative outcomes. Interestingly, there is emerging low-certainty evidence that cannabidiol or CBD, a non-intoxicating component of cannabis, may help reduce anxiety in patients with anxiety disorders. However, this evidence is still preliminary and more research is needed to confirm these potential benefits. For now, CBD may offer some hope, but it should not be considered a proven treatment. THC-predominant cannabis use is associated with substantial risks for mental health. These risks include the potential for worsening symptoms in certain conditions, such as mania in bipolar disorder, and increased psychotic symptoms in those with psychotic spectrum disorders. Understanding these risks is crucial for anyone considering cannabis as a treatment for mental health issues. Significant concern with regular cannabis use is the development of cannabis use disorder, or CUD. Among people who have used cannabis in the past year, about 3 in 10 develop CUD. This disorder can range from mild to severe and often leads to negative social, employment, and other adverse outcomes. Recognizing the signs of CUD is important for early intervention and support. Those diagnosed with cannabis use disorder, about half experience moderate or severe forms of the condition. This can result in significant disruptions to daily life, including problems at work, in relationships, and with overall well-being. The impact of CUD can be far-reaching, making it essential for individuals and healthcare providers to address it proactively. Regular use of high THC content cannabis products by adolescents and young adults is particularly concerning. This group is more vulnerable to the negative effects of cannabis, including an increased risk of developing mental health disorders and cannabis use disorder. Early intervention and education are key to preventing long-term harm in this population. Given the potential risks, counseling patients about the dangers of cannabis use is a critical part of promoting safety. Clinicians should provide clear, evidence-based information to help patients make informed decisions. Open communication can empower individuals to weigh the risks and benefits and seek alternative treatments when appropriate. Despite widespread use, there is still a lack of clear, high-certainty evidence supporting the benefits of cannabis for most mental health conditions. This uncertainty should encourage caution and further research, rather than reliance on cannabis as a primary treatment option. Patients and clinicians alike should stay informed as new studies emerge. For those struggling with mental health symptoms, there are many evidence-based treatments available, including therapy, medication, and lifestyle changes. These approaches have been studied more extensively and are generally considered safer and more effective than cannabis. Exploring these options with a healthcare provider can lead to better outcomes. Clinicians play a vital role in guiding patients through the complex landscape of mental health treatments. By staying informed about the latest research and maintaining open, non-judgmental communication, healthcare providers can help patients make choices that prioritize safety and well-being. In summary, while cannabis is commonly used by those with mental health conditions, the evidence supporting its benefits is limited and uncertain. The risks, particularly with THC-predominant products, are significant and should not be overlooked. Patients and clinicians should approach cannabis use with caution, prioritize proven treatments, and maintain open dialogue as research continues to evolve.